Since the 1990s, cancer rates among people under 50 years old around the world have been on the rise. That according to a new report that outlines some of the risk factors and, most worrying, asks the question, is early onset cancer an emerging global epidemic? With us now to find out more about cancer in younger people, let's welcome, in Boston, Massachusetts, one of the authors of that report, Timothy Rebick, professor of cancer prevention at the Harvard University's T.H. Chan School of Public Health and a professor of medical oncology at the Dana-Farber Cancer Institute. In Calgary, Alberta, Michelle Butterfield, senior national online journalist at Global News. And here in the downtown core of Ontario's capital city, Dr. Abha Gupta, medical director of the Adolescent and Young Adult Oncology Program at University Health Network. And we're happy to have the three of you with us tonight here on TVO to tackle a subject that is difficult but sadly timely. And Timothy, I want to start with you because you're part of the team at Harvard that published that recent report on early onset cancer. Let's just start there and make sure we all understand what we're talking about. Define early onset cancer. What does it mean?
The way we used this definition was by 50 years of age. And we did that only because it's easier to make that comparison. But I think the important point is that cancers are being diagnosed earlier and earlier across a lot of different tumor sites. And so we're not necessarily talking about a specific age. We're just talking about cancers that are diagnosed at an early age compared to what we're used to seeing, which is usually later onset cancers.
And a quick follow-up for you. Do you believe that there is an emerging global epidemic for cancer among younger adults now?
Well, there's no question that the rates of cancer diagnosed in younger individuals is increasing for many cancer types. I don't know that we'll call it an epidemic just yet. It's not COVID, but it is certainly something that is worrisome and something that we need to think about because it is changed very rapidly over the recent decades.
Abha Gupta, we've got you at Princess Margaret Hospital right now, which is, of course, the major cancer treatment center in all of Canada, but certainly here in Southern Ontario. What's your understanding of whether we're into a very unhappy trend as it relates to early onset cancer?
Yes, I think that there's many issues here. One is, as has been mentioned, in terms of the rising awareness and incidence of cancer, but also how young people are able to cope with their cancer journey. And this is really what makes them unique and sets people who are young diagnosed apart from their older individuals who are diagnosed with cancer, for whom it may be less unexpected, let's say in their 7th or 8th decade of life, compared to when one is younger.
If there's more of this happening to more and more younger people, Abha Gupta, can you tell me what that does to the ability to sort of provide resources for the healthcare system as a whole?
Yes, thank you. So, for example, those diagnosed under the age of 39 represent only 10% of the total adult cancer population. And all of those individuals are obviously seen in an adult cancer system, which is overwhelmed by the total volume of cancer patients. However, we know from years of research and our own experience that young people who are diagnosed with cancer do need dedicated programming in order to address their needs, some of which are unique to their age. These include things such as preserving fertility before their cancer treatment begins. Sometimes there's disruption to their early stage career or transition to post-secondary education or thereafter, which also needs specific attention. Finally, being diagnosed with advanced or incurable cancer also is a very special topic and definitely portends to dedicated attention, programming, and resources.
Now, Michelle, you're a journalist. Of course, you cover this story, but this is more than a story for you. This is certainly more than just another story for you. Tell us why.
100%. I was diagnosed with cancer when I was 37 years old. And then a year later, I was diagnosed with a second cancer. So, yeah, I'm very familiar with cancer in young adults.
You were in your 30s when this happened to you?
Yeah, I was 37 years old. I had a 1-year-old and a 3-year-old at home at the time.
Oh, wow.
Even Dr. Gupta just said, oh, wow, which prompts the follow-up for me. How the hell did you get through it all?
That's a really good question. I was really, really lucky. I have a really strong support system, great friends, great family, great neighbors, but it was not easy at all. I think it really lends to the conversation that we don't have a lot of support for young people, right? The needs that I had were really different than what someone, for instance, in their 60s or 70s would have, and it was tough. But yeah, we were just very lucky and blessed to have a really great support system on our side.
And again, I don't want to invade your privacy too much here. You've been good enough to join us here for this discussion. So if you don't want to answer any of these questions, you just tell me so. But the two cancers, were they two different cancers in two different parts of your body?
So, first of all, I'm an open book. Don't worry about invading my privacy. I'm pretty open with all of this stuff. So I was diagnosed with two breast cancers, two different breast cancers. So the first cancer I was diagnosed with was called invasive ductal carcinoma, and it's the most common breast cancer. The second cancer that I was diagnosed with was called Paget's disease of the breast, and it's a really unknown type of cancer. A lot of breast cancer patients don't even know that this cancer exists. I've been told it's diagnosed very irregularly, especially in younger women. And I had that cancer the entire time I went through my first cancer diagnosis, and no one would listen to me. I was breastfeeding when I was diagnosed with cancer, and my son was a biter at the time. So there were symptoms that are common with Paget's, but are also common in breastfeeding. So I was going through that diagnosis, that first diagnosis, and I said, this isn't right, this isn't right. And they said, no, it's a symptom of the chemotherapy, it's a symptom of the surgery, it's a symptom of the radiation, you're unable to heal. That's why these symptoms keep popping up. And it wasn't until I finished my treatment about 6 months later that the symptom wouldn't go away, and I had to demand a biopsy. And about a week later, I was diagnosed with that second cancer.
My goodness. Timothy, I saw you nodding your head during the course of Michelle's telling her story there. Do I take it this is not an unfamiliar situation for you?
Well, it's not a common situation, certainly. I think that the reason I was nodding my head is because it's really difficult when these unusual cancers arise at an early age, concomitant with other things going on, like childbearing and breastfeeding. That symptoms that might be seen outside of these other situations, would have been detected, would have been followed up. And I think that a lot of clinicians don't necessarily look for things outside of what they're familiar with. And so that's the story is not unfamiliar. The situation obviously isn't very common.
But can you follow up on that in this regard? There are people, and I guess Michelle's a great example of this here, there are people who can sense when something is wrong, and they can tell that the official explanation they've been given just doesn't ring true. How much of that's going on in your view?
Yeah, I'm so sorry to hear about your story, first of all. And definitely when a young person notices an ache or pain or something different, cancer is definitely not the first thing that anybody would consider. For example, somebody would have a pain in their shoulder, one would attribute that to anything except for cancer. And, in your story, for example, it's surprising that you had to go through that distress of knowing something was wrong or after you've already been through a cancer experience. So I'm so sorry to hear that. But for those who are just embarking on the cancer system, absolutely, I think that it is difficult for primary care physicians to think of cancer compared to the general population, it would be a rare occurrence. However, I personally think that this goes back to being able to have a good family physician, access to primary health care, and a team that actually gets to know you very well, so that if there is something wrong with your body, then they have something prior to kind of go back to.
Yeah, Michelle, maybe you could help fill in some of the blanks there. How did you have a sense that it wasn't whatever the official explanation of the day was, and was in fact something much more serious?
Yeah, so that's a really good question. So like I mentioned, I was breastfeeding my son, and I kept getting what I thought was mastitis, and it likely was mastitis. Mastitis is an infection that develops really quickly when you're nursing, and it just comes from blocked milk ducts within your breast. So it was producing kind of a hard lump-like area, and The problem with mastitis is the onset is so very fast that it's difficult to get in with your primary care physician right away. So I was going to walk-in clinics and being seen by mostly male doctors, and they're a little bit hesitant to maybe do a breast exam. They would just give me a prescription for antibiotics and leave. And finally, on my third bout of mastitis in about 3 months, my doctor just said, "You need to stop nursing your son. This isn't healthy. You can't be going on antibiotics this often." So that was fine. I stopped nursing. And then a few months later, I was on vacation and I was just noticing my swimsuit was rubbing against where that lump had been. And it just felt really uncomfortable. And I noticed that that lump hadn't gotten any softer. And that's when I prompted myself to make an appointment to go to my doctor. We did a breast exam. And even she said at that time, it doesn't feel like anything funny, but let's send you for a mammogram and an ultrasound. And the amazing thing is that on my mammogram, I had a 5 centimeter tumor. That's quite large, but it didn't show up on my mammogram at all. It was only when I had the ultrasound that they could see that tissue had changed within there. And then I was sent for a biopsy.
Abba, can you tell us whether when somebody is diagnosed with cancer in their 30s versus if you're in your 70s or 80s, whether there is an approach to treatment that is essentially the same or very different?
Yes, great question. I would answer that in two different parts. It is possible that the actual chemotherapy or treatment recipes are similar depending on what cancer one has. However, there is increasing attention and awareness to the actual biological differences in the tumors, which may then lead to, you could say, personalized medicine or tweaks to that cancer treatment plan. But secondly, as kind of I mentioned previously, the treatment paradigm that complements the chemotherapy in the form of supportive care, both for the patient and for their family members, their partners, their children, their parents, I think is an integral part of ensuring that their cancer journey is smooth.
Can I infer from that, though, that if somebody's in their 30s, you're going to take a much more aggressive approach to treating them than someone in their 80s who, for example, might not be able to withstand surgery, for example?
Well, you could say 80s, then you 70 now. So it's, I don't want to seem ageist, but I think that what we do need to recognize is that there's definitely biological differences. For example, in Michelle, who had premenopausal breast cancer compared to, a woman who has breast cancer when they're postmenopausal or later in life. And there are definitely, in breast cancer specifically, many treatment differences depending on age. In other types of cancers, absolutely, you're right to say that a young person would likely be able to tolerate much more aggressive interventions such as surgery or more intensive chemotherapy compared to somebody who might be 40 years their senior. Absolutely.
Okay. Timothy Rebick, I want to read an excerpt from your report right now and then get you to comment on it. Here we go. That there is increasing incidence of early onset cancers in several organs, such as colorectal and pancreatic cancers, which might not be fully explained by screening, is also apparent. This trend could reflect increased risk factor exposures in early life and/or young adulthood. Just that segment there that I read, what does that tell us that we sort of didn't already know?
Well, I think, first of all, we have changed our protocols for screening. We're often screening individuals earlier for cancers, and that might detect a little bit of cancer sooner, right? If you don't start screening breast cancer or colon cancer until 50, you're going to miss those cancers under 50. So the question is that really the explanation for these earlier onset cancers? And we think not. We think that there are more global trends that are associated with exposures and lifestyle. Interestingly, the majority of cancers that we see increasing in early onset are digestive cancers. And it's interesting to imagine that things that we know are happening in society, changes in lifestyle, changes in physical activity, and changes to diet and nutrition could be actually affecting people earlier than they used to be, particularly because obesity and diabetes and some of those factors are increasing in younger individuals. And so we're thinking that maybe there's a global trend in early onset cancers because of changes to lifestyle and diet. And also, this is probably a reflection of some of the other things that are going on. We know inflammatory bowel disease, diabetes, other diseases that are associated with these kinds of exposures are also increasing. So cancer is one of probably many health effects of changes in lifestyle.
Michelle, since you said your life is an open book, I'm going to keep opening that book. So here we go.
Sure.
What kind of treatment did you have in order to get yourself cancer-free?
So I underwent 8 rounds of radiation, and then I had a lumpectomy surgery as my first surgery, and then I did 33 rounds, so that's daily, of low-dose radiation to the breast and chest area. And then my second cancer was a single mastectomy cancer, a single mastectomy surgery.
How long did all of that take, that entire regimen?
About 2 years in total. Yeah, it was long. It was long. The second surgery wasn't nearly as difficult. I didn't have to undergo any chemotherapy or radiation after that. So I would say my first bout with cancer, it took about 11 months, beginning to end.
And you've anticipated my next question, which basically, do you, once you've recovered and gone through the whole recovery process, do you ever feel like you did before? Like, do you feel normal at all ever again?
Ooh, that's a really loaded question. It's difficult to say. Physically, I'm almost 4 years out from chemotherapy and all of that, and I'm starting to feel more normal. I think there's a lot of side effects that do linger, and it's really cancer specific and treatment specific. I suffered a lot with brain fog and memory issues. A lot of people have range of motion issues or other physical disabilities or even invisible disabilities. But I would say, a lot of people think the treatment ends and that's the end of it. I would say 100% it's the emotional aspect of cancer, the psychosocial aspect of cancer that's the most difficult. And, I think about cancer less now. It's been 4 years since my initial diagnosis, but I don't think that I'll ever really be free from that. It was a really big thing in my life, a very traumatic event, and I'm healing from it, but I don't think I'll ever be able to completely walk away from it.
And I presume you're going in for regular scans now. How often does that happen?
Actually, no, they don't typically scan. I go every 6 months to see my oncologist, but other than that, unless I have a complaint or something, they don't do any sort of exploratory medicine in that way. They don't do any CT scans or MRIs. I don't get blood work even. I just talk to my oncologist every 6 months, and that's kind of it. How
do you feel right now?
I feel good. I feel really good. I am doing great. Like I said earlier, it's really difficult. October was Breast Cancer Awareness Month, which always brings up complicated feelings. But I've really tried to make good things happen from my cancer diagnosis. I started a support group for young women in Southern Alberta. We're over 200 women strong, all living with or beyond breast cancer. I do a lot of advocacy work in the breast cancer space as well, too. And I just finished up a big series with Global News, an 8-part series discussing the issues that young people face when going through a young cancer diagnosis.
Good for you. That's wonderful. Abba, maybe we could pick up from where Michelle left off, in as much as there are unique challenges that people in their 30s who get cancer or younger face that perhaps people in their, I don't want to sound ageist here, but people in their 70s and 80s don't face. Can you talk to us about some of that?
Yes, absolutely. I think that Michelle touched on a very important aspect, actually, of being diagnosed with cancer as a young person, which is survivorship. And how does one lead their lives beyond the cancer journey? I think of my young patients as warriors who entered a war and kind of came out as heroes. And as you use the word trauma to describe your journey, and I would kind of echo that from all of the individuals that I've spoken to. I think that having your whole life ahead of you still, beyond cancer is really what sets this apart, because you have to figure out, how do I overcome the trauma that I experienced in my past with the cancer, its treatment, its diagnosis, fear of cancer recurrence, but also continue to, follow my career dreams, my family, and all those other roles that are still ahead of you.
Timothy, you having done this report with Harvard, and we now have more information about this than we had before, what would you like to see emerge as a result of this additional information that we now have?
Well, I think we learned from from the report that the clinical community, a lot of the people out there don't really appreciate early onset cancer. They're just, as we just heard, that there's a lot of people out there whose symptoms, whose situation is poo-pooed rather than followed up upon. And that's something that we need to educate both the clinical community as well as the patient, the general community, so that people who are at risk of cancer, people who may have cancers or symptoms, advocate. As we just heard, she advocated for herself and made something happen, and probably saved her life as a result of that. And people won't advocate for themselves if they don't understand that they should be following up on their symptoms. They should be questioning their doctor's decisions. They should be understanding that there may be something more going on than what the doctor sort of expects to see. And as cancers in younger people are more and more common, we really need to make sure that people are educated and clinicians are educated to look for these symptoms.
Do you worry about the converse effect happening, namely that the minute anybody who's young and gets a pain, their immediate thought will be to leap to cancer, when probably in most cases that's not going to be the case?
Well, that's where the education comes in. We need to have people understand what the symptoms are that they need to be concerned about. We need to have the clinicians understand when there's something that might be cancer, not an ache or pain. This education needs to happen, and it really hasn't, because people are not familiar with early onset cancer. They're not familiar with the symptoms, and as a result, they either underdiagnose or under-intervene. I don't know that there's too much over-intervention at this point, but proper education about what's going on as younger people are more diagnosed with cancer more is really critical.
Gotcha. Michelle, I want to circle back to something we talked about a moment ago, where you talked about living with cancer and whether you'll ever be able to think of yourself not associated with that disease. And I want to pull a quote here from something that you wrote. Here we go. Here comes the quote. "What I didn't know was living with cancer in my body would be less distressing than living life as a cancer survivor. My hair grew back, signaling to the outside world that I was, quote unquote, better. But that couldn't be further from the truth. I will never fully shed this disease, no matter how long I remain in remission." I guess I want to know, Michelle, whether you can, that's pretty categorical, what you just wrote there. And I wonder whether you ever do imagine a day where you'll get up in the morning and this won't be one of the first things that you think about.
I'm really hopeful that that's the case, but the type of cancer, the type of breast cancer that I had, it has a really high recurrence rate. A lot of people say that it's going to come back within the first 5 years, if it's going to come back at all. But, you never walk away from that. You never walk away knowing that you're cancer free for the rest of your life. It's either something else is going to kill me or it's going to be cancer, and I won't know until that happens. I think I'm hopeful emotionally that, one day I'll be thinking about it less, and it'll be, less anxiety producing. But I just really, take a lot of solace in spending time with other people that have walked this journey, other young women that have been through it as well too, because I think that it's really difficult. I'm a really high functioning person. I'm energetic. I love to be active. I love my job and playing with my kids and having a great social life and that kind of thing. So I think that it really appears to the outside world that I'm doing great. I'm fine. But there's a lot of hidden stuff that's going on, and I have to work on that every day. I still go to regular therapy. I still, seek support from my friends that have been through this. Because I just don't know that will ever not be part of my story.
You mentioned your kids there. Your kids were very, very young when this happened. Undoubtedly, they had
Yes.
sort of no understanding of what was going on, but they're a little bit older now. How much do they
Yeah.
know about all of this?
So they know that mom had cancer. My daughter was 3 at the time. She turned 4 kind of during my cancer treatment. So she remembers some things. Like she remembers the day that my husband shaved my head, for instance, when I was losing my hair from chemotherapy. She remembers, mom having to go to the hospital quite often. My son doesn't remember anything. It's really interesting. This year at school, they did the Terry Fox run and they wear the little penny flag on their shirt that says, I'm running for blank. And they both wrote on there, I'm running for Terry Fox. And I was like, but you're not running for your mom? And they were like, oh yeah, we forgot you had cancer, right? Like it's not on top of mind, right? And we still talk about when mom had cancer because unfortunately there's other people. We lose people. I lose friends to cancer quite often every few months. There's lots of women I know living with metastatic disease. We lose neighbors, we lose friends, we lose family members. So cancer is often in the conversation, but luckily they don't remember a lot from my personal experience.
I was going to say that's actually kind of a wonderful thing that they wrote, I'm running for Terry Fox and not mom, because it suggests they're not traumatized by your experience, and that's great.
Exactly. It felt really good to, at first I was a little bit puzzled. I was like, well, why wouldn't you run for me? But then I was like, they don't actually remember. And that's a really good feeling.
Okay, in our last couple of minutes here, Abba, I want to turn the microphone back over to you and talk about, since this appears to be a growing phenomenon amidst us, what do you need?
Yeah, thank you for asking that. We definitely need support from at the government level, at the federal level, and then also at the provincial level to really be able to execute standardization of support for young people with cancer. At this point in time, there's individuals like myself and individual institutions that are able to kind of create program for adolescents and young adults with cancer, but this is definitely insufficient and unfair, really. There should be no geographical, advantages here. And so it's a plea, actually, a plug to both levels of government, all levels of government, really, to put this on their radar and increase support and awareness for young adults going through cancer. Thank you so much.
In terms of awareness, I mean, during the World Series, you've got those moments where people hold up signs saying, I'm thinking of, and the other night on Hockey Night in Canada, we saw the same thing where people fill in the names of those they are thinking about who are fighting cancer. So in terms of awareness, you got a lot going for you. Abba Gupta from UHN, Timothy Rebick from Harvard University, and Michelle Butterfield. I know every single person watching or listening to this is thinking good, positive, energetic thoughts for you. And we're grateful to all three of you for joining us on TVO tonight. Many thanks.
Thank you.
Thank you so much.
Thank you so much.
The Agenda with Steve Paikin is made possible through generous philanthropic contributions from viewers like you. Thank you for supporting TVO's journalism.